monkeypox cases in New Jersey have climbed past 100 statewide as New York State plans to declare a public health emergency. For more on monkeypox, we turn to Dr. Perry Halkitis. He is the Dean of the Rutgers School of Public Health. Welcome back to the show, Perry.
Hey, Alex, great to see you.
How dangerous is monkeypox?
So here we are again with another infection, right? So monkeypox is not a fatal disease. It is a disease that is spread easily by person-to-person contact, but unlike COVID-19, unlike other pathogens, it is not a fatal disease, and it is one that people can acquire easily, but ultimately will not kill them.
So what's the appropriate, I can already hear the groans of another disease, the media wants to jump on it, COVID's played out, they want another one. What's the appropriate level of concern here?
Yeah, so there's some concern here. The concern here is that it's like, here's a disease that has existed in Africa since the 1970s that all of a sudden finds itself in Europe and in the United States. And it's, the concern is that if we don't get it under control right now, if we don't vaccinate, if we don't, get people injections into people's arms and stop it from spreading further, this disease becomes another endemic disease that exists in our population. And that's the last thing we need right now. We're dealing with COVID. We still got HIV after 41 years. There's other pathogens that are sure to enter into our population. So we just need to stop it and get rid of it and eradicate it like we did polio, although, as we know, there's been a polio case in the last week.
That's right. And I know that you've done a lot of work on measuring, mapping the spread of HIV/AIDS among the gay community in the 80s. Is this similar here? Are there similarities here?
So first and foremost, let's be clear that monkeypox is not a sexually transmitted infection like HIV is. It is an infection that is passed by intimacy, by close connection. I've been using this expression, Alex, to explain it. If you have sex with somebody and you have the flu, they might get the flu. That's not a sexually transmitted infection. It's the same thing with monkeypox here.
Got it.
So it's like HIV in that right now it's primarily in gay and bisexual men. This disease, it certainly doesn't just affect the gay and bisexual men. It is not about being gay. It is not about the kind of sex gay men had. It is about intimacy and touch and close connection. And as a result of that, you can get it from sleeping on a sheet or touching your child or or hugging your grandma. So it's a very easy disease to spread that has nothing to do with being gay.
Gotcha. I wanted to ask you about President Biden's COVID case. He emerged from isolation this week. The White House says it doesn't matter where he got COVID. Does it?
We're all going to get COVID again. That's
but he's the president. He's not like me just being out there.
I think it's very difficult to trace back where people get COVID from. All right. I think that, even when I think about back to my case in March of 2020, where did I get it from? The PATH train, the gym? I have no idea. I guess it matters. Ultimately, at the end of the day, what matters more is continuing to have people boosted and vaccinated and stopping the spread of the disease. I think that's our biggest concern right now, which is what's going to happen in the fall? How are we going to get shots in people's arms, keep them boosted? How is the vaccine going to be updated to address these new variants and contain it that way? And hopefully, folks like President Biden, don't get infected. But unfortunately, I see way too much infection going on in New Jersey and the United States right now, simply because this variant is out there, this BA5, and it seems to be eluding the vaccines in their current formulation.
And tell me about the BA5, though. We hear these variants kind of rush by me. What makes BA5 different?
So, it's part of the Omicron strain, and is that we had BA1, we had BA2, we had BA4, we have BA5. BA5 seems to be able to infect really easily. It seems to evade vaccination in the sense that people get disease states, they feel sick and what have you. It seems like the immune response from the original version of the vaccine, which was based on alpha, is not sufficient to control BA5. So what the pharmaceuticals are doing right now, like they do with the flu vaccine every year, is they're updating it to deal with these strains. Right. It is very easily transmittable and it causes disease. Although if you're vaccinated, as we saw with President Biden, you will get some symptoms, but ultimately you will be okay.
All right, Dr. Perry Halkitis of the Rutgers School of Public Health. Thanks as always for joining us.
Alex, always so great to be with you.
As for you, stay with us.